This week's Ask Dr. Durie comes from a patient who asks a common question. The question is, I want to eat what's best, but I'm so confused about what is the best food for a myeloma patient to be eating these days. Well, the answer is relatively straightforward. As I've said with many blogs and previous videos, the best food is real food. But what does this really mean? Obviously, it's not just so simple. The additional recommendation is that if you eat real food, you should avoid eating processed food. And this is a very, very key and strong part of the recommendation, because what we know is that processed foods have several disadvantages. Number one, because of the industrial processing, the processed foods have what is called a high glycemic index, which means that this type of food is predisposed to increase weight and lead potentially to obesity. The other thing is that industrially processed foods do have contaminants in them which can have a negative effect, and these include things like aspartame and acrylamide and different chemicals which can have a negative effect on your body. And so several things that are bad about processed foods. And so for the real food, what are the key things to keep in mind? Well, number one, it's important to have fresh food, if possible, organic food, if possible, if it's meat, a relatively small amount of meat intake on a regular basis, grass-fed, to stay low on carbohydrate intake, and to be cautious about fat intake, but recent studies suggest that it's not necessary to completely avoid fat intake. In fact, eating butter and even eggs are okay, and those are not a particular or serious negative. And so the bottom line is to stick with real food, to avoid processed foods, and to achieve that, the best is to do your best to shop and to cook at home with as much fresh produce as you can manage, and to eat in the comfort of your own home, and avoid all of the issues that can emerge if you eat out and or if you eat processed foods.